Your testosterone did not rise. That is the first thing I want you to understand, because almost every explanation you have been given about menopause, and your hair gets this backwards. Nothing new arrived in your body to attack your follicles. What happened is that something left. Estrogen has been quietly protecting your hair your entire adult life, holding your follicles in their growing phase for longer. And when it declines, the androgens you have always had, same hormones, same follicles, completely different result. And that distinction matters enormously because it changes what actually helps. Today, I'm going to explain what is genuinely happening, how to tell whether this is menopause or something else hiding behind it, and what has real evidence. Stay with me to the end, because number one is the question I get asked more than any other in this situation, and almost nobody gives a straight answer to it. Your doctor has probably never had time to explain this properly. Not because they are hiding it, because appointments are too short, and hair is the thing that gets dropped. I'm Dr. Alan Brooks. I have spent 35 years as a board-certified dermatologist focused on hair and scalp. And more than 10,000 patients have sat across my desk. And I want to say something before I go further, because it would be strange not to. I am a man, and I have not lived through this. What I have done is treat a great many women through it, and listen to the same account so many times that I know the shape of it before it is finished. The part I hear most is not about hair at all. It is that somebody said the words, "It is just the menopause," and the conversation ended there. That sentence is where a great deal of treatable hair loss goes to die, because menopause is a genuine cause, and it is also the most convenient place to stop looking. This channel is where I say what I never have time to say in a 15-minute visit. Maybe you know the exact moment this became real for you. Your ponytail felt thinner in your hand. Your part looked wider under the bathroom light, and you told yourself it was the angle. Your hairdresser mentioned it, kindly, and you have thought about it every day since. And on top of everything else, your body has been doing without asking your permission. This one is the one people can see. I want to say clearly that caring about this is not vanity, and I have never once thought it was. Hair is bound up with how you recognize yourself, and losing it during a period when a great deal already feels out of your hands is genuinely difficult. It is also, in a good number of cases, more treatable than you have been led to believe. So let me explain what is actually happening, because once you see it, everything else follows. Your hair grows in cycles. Each follicle spends years in a growing phase called anagen, then rests, then releases that hair and begins again. The length of that growing phase determines how thick and how long your hair gets, and estrogen extends it. That is the key fact. Estrogen keeps your follicles growing for longer. You have seen this yourself, even if nobody explained it. It is why so many women have the best hair of their lives during pregnancy, when estrogen is high, and why so many shed dramatically 2 or 3 months after giving birth, when it drops. Menopause is the same principle playing out in slow motion over years instead of weeks. Now, at the same time, your ovaries were producing estrogen, but your body was always producing small amounts of androgens too, and it continues to. So picture two people pulling a rope in opposite directions. Estrogen on one side, androgens on the other, roughly balanced for decades. At menopause, one of them lets go of the rope. The other has not become any stronger. She has not grown. But the rope moves, and it moves fast, because nothing is pulling back anymore. That is what is happening on your head. Your androgens did not increase. Their influence did, because the counterweight went. And in follicles that carry a genetic sensitivity to those androgens, which is inherited, and which you may share with your mother or your father. That shift is enough to begin the slow shrinking process we call miniaturization. Follicles do not die. They rebuild slightly smaller each cycle, so the hair comes back finer and shorter, until eventually it is too fine to count. And that is genuinely hopeful, because a smaller follicle is a living follicle, and living follicles can respond. So let us go through the 5 things you need, counting down. Number 5 is that it is very often not only menopause, and this is where I want you to be quietly stubborn. Menopause is real and it is a genuine cause, but it arrives at an age when several other causes of hair loss also become common, and it makes an extremely convenient explanation that stops further investigation. The 2 that I find most often, and that are entirely correctable, are low iron stores and thyroid problems. Iron matters because your follicles are among the most metabolically demanding tissues you have, and they need oxygen delivered constantly. And here is the detail that catches so many women out. A standard blood count can come back normal while your iron stores are on the floor, because your body maintains your hemoglobin by draining your reserves first. The test that shows reserves is called ferritin, and it is not always included, so you have to ask for it by name. Thyroid matters because that gland sets the metabolic pace of every cell you own. And both an underactive and an overactive thyroid cause hair loss, and thyroid problems become considerably more common in women in exactly this age range. So the mistake is accepting the first explanation because it fits your age. Ask for ferritin, thyroid function, and vitamin D, and ask for the actual numbers rather than the word normal. Number 4 is that there are usually 2 different processes happening, and they need different responses, so telling them apart is worth your time. The first is a shedding episode, which doctors call telogen effluvium. It is common in perimenopause. It is diffuse across your whole head, including the back and sides. It arrives relatively suddenly over weeks. It often follows a stressful event or an illness by 2 to 3 months, and the crucial thing about it is that it is usually temporary and it recovers. The second is female pattern hair loss, which is gradual. Follows a pattern rather than affecting everywhere equally, creeps in over years rather than weeks, and is progressive, meaning it continues unless something is done. Here is how to tell. If your hair is coming out in handfuls and your whole head feels thinner, including the nape of your neck, that leans toward shedding. If your hair is not really coming out in unusual amounts, but your part has slowly widened, and the top of your head has less coverage than the back, that leans toward pattern. Many women in this stage have both at once, which is why it feels so confusing. The mistake is treating the second as though it were the first and simply waiting for it to pass, because pattern loss does not pass. Now, before we go further, let me mention something I will come back to properly in a moment. Everything I am doing in this video is narrowing, telling you which family of hair loss your situation is likely to belong to. Doing that well is the difference between an appointment that produces an answer and one that produces the word menopause. Number 3 is understanding what female pattern hair loss actually looks like, because it is different from what happens to men, and knowing that spares you a great deal of unnecessary fear. Women very rarely go bald in the way men do. The classic female pattern is diffuse thinning across the top of the scalp, with the frontal hairline largely preserved, which is why your face is usually still framed by hair, even when the crown has thinned considerably. Dermatologists describe the widening part as looking like a Christmas tree shape when the hair is parted, wider at the front and narrowing back. So if you have been frightened by images of male baldness, that is not where this is heading for the overwhelming majority of women. And there is a practical use for this, because women retain their frontal hairline in pattern loss. A hairline that is genuinely receding in a woman is a signal to look more carefully, rather than to assume it is the same process. And I will come back to that in the safety section, because it matters more than anything else in this video. Before I give you the top 2, do something for me. Type in the comments whether anyone has ever told you it is just the menopause and left it there, yes or no. And tell me your age, and roughly when you notice the change. I have a strong suspicion the yes column is going to be considerably longer than it should be, and I think it will be useful for a lot of you to see that. Number 2 is what actually has evidence, and I'm going to be specific rather than vague. The treatment with the best evidence, and the only one specifically approved for female pattern hair loss, is topical minoxidil at 5%, applied once daily to the scalp. It does not touch hormones at all. It works by improving blood supply to the follicle and by pushing resting follicles back into their growing phase, which is why it helps regardless of what your estrogen is doing. 2 things you must know before starting it. The first is that many women shed more in the first 4 to 8 weeks, and this frightens people into stopping at exactly the wrong moment. That shed happens because resting hairs are being pushed out to make room for new growth. It is the treatment starting, not failing. The second is that it only works while you use it, so this is a long-term commitment rather than a course you finish. Beyond that, there are prescription options your doctor may consider, including spironolactone, which works against the androgen side of that rope and is used off-label for this in women. It requires monitoring, and it is not suitable for everyone. And a word on finasteride, because you will read about it. It is not the automatic answer in women. The evidence is more mixed than in men. And it is absolutely contraindicated in any woman who could become pregnant. That is a conversation for a doctor who knows your full situation, not a decision to reach on your own. And now, before number 1, let me give you the thing I mentioned. There is a written companion guide to this channel, and its whole purpose is the job we have been doing here, which is naming which kind of hair loss you are actually dealing with before anyone starts treating it. It sorts the families of hair loss by speed, by distribution, by symptoms, and by whether the follicular openings are still visible, and it has a chapter specifically on what shifts at menopause. Every statement in it carries its source and its year printed on the page, so you or your own doctor can look it up. And where the research disagrees, both sides are printed with their sample sizes. There is also an appendix at the back listing what could not be verified in a primary source, which is not something anyone else in this field publishes. 1 payment, no subscription, delivered as a PDF. If you have been told it is just the menopause and sent away, the thing you were missing was never another product. It was a name and the language to ask for it. You will find it linked in the description below. And now number 1, the question I am asked more than any other in this situation. Will hormone replacement therapy bring my hair back? Here is the honest answer, and it has 3 parts. First, it is logical to expect it might, because if declining estrogen removed the counterweight, restoring some estrogen should restore some balance, and that reasoning is sound. Second, the actual evidence on hair specifically is limited and mixed. Some women do notice improvement in hair quality and reduced shedding. Others notice nothing. And importantly, the type of hormone therapy matters, because some progestogens used within these regimens have more androgenic activity than others, and that can work against your hair rather than for it, which is a genuinely useful thing to raise with your prescriber if hair matters to you. Third, and this is the part I most want you to take away, hormone replacement therapy is not a hair treatment, and it should not be started or avoided because of your hair. It is a serious medical decision with real benefits and real considerations around your bones, your heart, your symptoms, and your personal history. And that decision belongs to you and a doctor who knows all of it. What is entirely reasonable is to say, if I am considering this anyway for my symptoms, is there a formulation that is less likely to work against my hair? That is a good question. Deciding to take hormones because of your hair, or refusing hormones you need because you read something about hair, would both be mistakes. Let me tell you about Susan, 56, a patient of mine, who came in having been told twice that this was simply her age. Her part had widened over about 3 years. We did 2 things. We ran proper blood work, and her ferritin came back low, which nobody had checked, and we started topical minoxidil. Her hormone therapy decision she made separately with her own doctor, on grounds that had nothing to do with hair. At her follow-up 9 months later, her shedding had settled, and there was fine new growth along the part. Was it the iron or the minoxidil? I do not know, and I told her so. Both were probably contributing, but she had spent 3 years being told there was nothing to do, and there had been something to do the entire time. So here's exactly what to do. First, book an appointment and ask for 4 things by name: your ferritin, your thyroid function, your vitamin D, and a full blood count. Say clearly that you are experiencing hair loss so they understand why you are asking, and ask for the numbers rather than the word normal. Second, before you go, take photographs in bright, even light, one directly above your part and one of your crown, and date them, because a photograph of your own scalp is genuinely useful clinical information, and almost nobody brings one. Third, if it is pattern loss, ask specifically about topical minoxidil 5%, and if you started, commit to at least 6 months, and do not quit during the shedding phase in the first 2 months. Fourth, if you are considering hormone therapy for your menopausal symptoms anyway, mention your hair so the formulation can be chosen with that in mind. And fifth, be gentle with what you have, because hair in this phase is more fragile, so no tight styles, no aggressive towel drying, and heat kept moderate. One thing, doctor to viewer, and this is the most important part of this video, so please do not skip it. There is a condition that specifically affects women around and after menopause called frontal fibrosing alopecia, and it behaves differently from everything else I have described. The frontal hairline recedes in a band, moving backward, often with loss of the eyebrows and sometimes with redness, itching, or a shiny appearance where the follicle openings have disappeared. That combination, a receding band at the front plus thinning eyebrows, needs a dermatologist promptly rather than eventually, because it is a scarring type of hair loss, meaning the follicles are replaced by fibrous tissue and do not come back. Caught early, it can often be halted. Caught late, it cannot. So if that describes you, make the appointment this week and use those words. The same applies to distinct round patches, or a painful, burning, or persistently red scalp. I am a doctor, but I am not your doctor. Now, one last honest word. I am not going to tell you that any of this returns your hair to what it was at 30, because it does not. And you have been told enough things that were not true. What I will tell you is that the sentence, "it is just the menopause," is one of the least useful things anybody can say to you, because it is simultaneously true and completely unhelpful. Menopause explains why this started. It does not tell you whether your iron is low, whether your thyroid has drifted, which type of loss you have, or which treatment fits it, and every one of those questions has an answer available to you. Expect any shedding to settle within a couple of months of correcting whatever is low. Expect fine new growth around month 3 to 4 if you start treatment, and expect an honest verdict somewhere between month 6 and 12, because hair always lags behind everything else. So make the appointment, ask for those 4 tests by name, and refuse to leave with only the word menopause. And come back and tell me in the comments what your ferritin turns out to be, and whether anyone had ever checked it. Type your age too. I read every single one. Take care of yourself. I will see you in the next one.